want to read to you one of the 7 public notices put out by public hospitals throughout the country. And it will highlight the desperate situation that we are going through today. There is continuous stock out of drugs and medical consumables at the area medical store in Mount Hagen and a cash flow problem in Hela province. And therefore, the following services will be closed down. 1. All specialist consultation clinics. So any patient that needs a specialist doctor will not be seen by a specialist doctor. 2. All elective surgeries to stop immediately as of this notice, which was on the 20th of October 2025. Number 3, no elective referrals out of the province, only those regarded as emergencies. The system has failed.
Supply is fully functioning in the department. I have a system there that I have access to. Na misabi long what's happening long all records, lo system, lo health, lo country, lo set, lo medical supplies. Na it's actually functioning. The supply is functioning at the moment. It's the people who are using the system to actually make sure that they understand and use it.
The Honourable Member for Abao.
Thank you, Deputy Speaker. My question without notice is directed at the Minister for Health. Mr. Deputy Speaker, in my long professional career as a doctor in this beautiful country, and as former Secretary for Health and as former Minister for Health, I have never seen a health situation in this country that we are going through today. It saddens me enormously, and I must say that our health system has broken down. I want to read to you one of the 7 public notices put out by public hospitals throughout the country. And it will highlight the desperate situation that we are going through today. And this notice is signed by a Dr. Tati, Director of Curative Services of the Hela Provincial Health Authority. His subject was scaling down of clinical services and elective surgery at the Hela Provincial Specialist Hospital. And the reason why he put this notice out, like all other 7 notices that are now finding their way in the Facebook, is that there is continuous stock out of drugs and medical consumables at the area medical store in Mount Hagen and a cash flow problem in Hela province. And therefore, the following services will be closed down. 1. All specialist consultation clinics. So any patient that needs a specialist doctor will not be seen by a specialist doctor. That's what it means. 2. All elective surgeries to stop immediately as of this notice, which was on the 20th of October 2025. And number 3, no elective referrals out of the province, only those regarded as emergencies. And Part B says referrals for advanced diagnostics like CT will be at the expense of patients and their relatives. So this government, Mr. Deputy Speaker, is now bringing health costs to patients and their relatives. The system has failed. My questions are, number 1, Deputy Speaker, when was the last public tender for medical supplies tendered by the Department of Health? I understand that there hasn't been a medical supplies public tender for a long, long time. The system that I established meant that the country must have 6 months supply of cushion, that you must have 6 months stock ready all the time. And so the tender processes must be managed in such a manner that we don't run out for 6 months supply in this country. That system has failed. I want the Minister to advise, when was the last public tender for medical supplies publicly tendered by the National Department of Health? Number 2 question. How many purchase orders have been submitted so far to the National Department of Health? What is the total cost of all the POs, purchase orders? How many of the purchase orders have yet to be paid? Because this means that we are running out of money. I'm aware that the bulk of the purchase orders submitted for medical supplies have not yet been paid yet. And so the supplies cannot be submitted. And because there is no public tender, many times these purchase orders are very expensive. The Department of Health, the provincial health authorities are going for emergency supplies. And when you do emergency tender, the costs go up 10 times or 5 times. We don't have the money to do that. I want the Minister to answer that question specifically. Number 4. I wonder if the Minister is aware of what we call the M supply system. It is a logistic management information system where it will give you the real-time status of medical supplies throughout the health facilities around the country. Then it will make sure that the health facility manager is ordering on time, because that M system, even the NDOH will also know that that particular hospital is running out of this item. No cotton wool, no oxygen gas, no propranolol, all those drugs. This M system was established, and it has been supported by many of our partners. The World Vision is the initiator. World Vision International developed this system. World Health, DFED, and UNFPA have been helping to train workers to manage this M supply system. I understand from the information I've got, this M supply system is not working. Can the Minister confirm or not? And I want to ask the Minister through you, Deputy Speaker, what happened to the M system? Because without the real-time information coming from all the facilities throughout the country, then the department is going in the dark. We don't know what's going on. I have had many friends and many relatives who come up the Port Moresby General Hospital, the premier hospital in this country, come in with a prescription, asking me to go and buy this drug because it's not in the hospital. Many doctors are writing prescriptions and even telling patients to go and buy the drug. Not only the drug, but the prescription also include needles, cotton wool, gauze, IV intravenous fluids, and even oxygen cylinders, Mr. Deputy Speaker. So somewhere in the system, our people are suffering because this government is failed to manage this essential service. Health is an essential service. And I can tell you, Deputy Speaker, many of our people are dying out there because this system has been made to fail. Thank you, Mr. Deputy Speaker.
The Honourable Minister for Health.
Thank you, Truad. The Deputy Speaker, midok thank you lo. All couple of questions come long. Member about lo totok lo concerns lo health lo country blue me. Yes me maybe agree lo totok lo some health and critical need na service lo people blue me. Very important. Alo follow question blue you first. Bando totok lo medical MS supply. Yes, start law MS supply. MS supply is fully functioning in the department. I have a system there that I have access to. Na misabi long what's happening long all records, lo system, lo health, lo country, lo set, lo medical supplies. Na it's actually functioning. MS supply is functioning at the moment. It's the people who are using the system to actually make sure that they understand and use it. And something when we find them out long. But MS supply system that tracks the stocks and the people who are actually placing the orders and system in work stop. And first talk. Second, third, first talk law. When was the last public tender? An important point. I will check in department law tomorrow. I mean now Sim talks have come back. Now purchase orders. More important talk when we need long present good. According to information, me agree also we need long strategies on the system long side medical supplies orders. Since these questions are raised, are important. Last Parliament sitting, the Governor of Oro asked people some question where 15 by recommendation come before the PAC, long illustrating medical supplies procurement, distribution, supply of country, which I put in talks with me, suppose the respond to last Parliament, but only put in was in a public statement where you can look in the newspaper and look in where we are at the moment. We are tracking 15 recommendations on what we are doing at the moment. So tomorrow by me, this week, Parliament by me kisim talk law. When was the last public tender go? Now supplies. Purchase orders where it wasn't felt to make him up now. But law just the information happening in today. Today yes, me look him. I'll send a letter where we look him. We come along director security of health where talk law all shutting down some section long hospital. Sad long emergency department especially. Yes, me fully aware of letter where come along Dr. Tati, which you refer long and dated 20th of October. I know all those letters. Now we check him all CEOs belong. Did the speaker at the moment. We got WhatsApp one them all the CEOs, lo PHAs, lo country that we communicate every day. Now ask him all what is the problem. Now we check him a CEO blow. Now some blow la letter. Only know consult on them all CEOs blow. Now put his home so lot of go out. But you know also me name all fake. I'm all doctors where only work directly on all sick man. Log him all authority, or director of medical security of health, long putting and talks have come out because they're always in contact with patients every day. Just lo talks have country, public in government, he put him 239 million kilo budget, medical supplies, lo tislaya. To date, information if kisim 182.3 million kina already dispersed medical supplies. That's remaining a balance of remaining balance of 57 million kina. That's 70% government give him. Now update them as of 28th of October last month. Immigration talks away as tracking through the again supply system. We got now 5 medical store, area medical stores in the country. But really, Isibik, Lowiwek, Hagen, Lo Layet, Lo Kokopo, about 70 to 80% of essential items, totaling up to more than 300 items. 70% of items will can last him the next 3 months. At the moment, that's happening. Halatau, last 3 weeks, he got 4 truck will carry more 600 box marasin loya. Benim Road now, Benim Highway na Halata for the first time. It's actually happening right across the country. We know how many trucks only delivered la Pabla EMS Playumi. I mean, one of stocks only got at the moment. I mean, like Tokli also government. That's coming from a 25 million kina where only use him. Another 48 million kina now only 5 new stocks that are now currently being dispersed as well. So we believe that by taking us through the end of this year, now first quarter of next year, we should see medical supplies. We should address all these things. Now, the point the letter where member Rifaloen, Dr. Sir Puka Rifaloen on 28th. Those letters, you look at where the dates blow along, September and October dates, especially October dates. As of end of October and coming now, I want to say today that we should have supplies coming through our health system. where we are at the moment. That's how we are tracking at the moment at the department. So we should see stocks coming through our health system. We are fully aware of all those letters that is coming through Nami Plus Survey, and we are communicating at the moment. Government, we're trying our best. Our aim is to release the remaining balance, and we see this through. But the questions regarding the main tender, I believe we will need to improve on that. Yes, I totally agree that we must improve on public tendering, so that we have come in mass contract now. It gets him good money now. Lolani can kiss him marasin na in planning in advance. It's something that, but I will give that information formally this week so that we answer fully. Thank you, Deputy Speaker.